Good day everyone, welcome to Blackboard Pharmacology. My name is Leanne, I'm a registered pharmacist and today we are going to discuss morphine and morphine-like substances. Now I've made a summary out of the SUMF, it's the book we use most often in South Africa. I made a summary for you that you can find on the website. It will be in a PDF form. It's basically handwritten digital notes that I made. If you feel like you want to take what I'm saying today, you want to maybe incorporate it into your studies or maybe just read through it again to refresh your memory, you can find that on the website. I'll put a link for the website on the screen right now and in the box below. Okay guys, let's start with morphine. Morphine is mostly going to be given in the form of oxycodone, and oxycodone goes by the trade name of OxyContin or oxynorm. It's also included in the product with the name of Targinact. Targinact is a combination of oxycodone together with naloxone. Alright, now let's look at morphine and what is the indications for morphine. Now the indications for this drug is going to be post-operative pain, any form of pain. It can also be antidiarrheal, it can also be a cough suppressant, but mostly a Schedule 6 morphine will be given to assist and ease the pain. Right, now some contraindications include diarrhea that is partnered with poisonous substances that has been ingested, as well as intracranial pressure that's very high, or any form of colitis, bacteria-induced colitis. It's a no-no when you're giving morphine to a patient. Alright, when we have to be cautious is if the patient has any disease that is going to suppress the body and the functions of the body. This will include things like hypothyroidism, hypertension, also prostatic hypertrophy, then your COPD patient or any respiratory disease that they might have, erythral stricture where they already struggle to urinate because morphine can cause urinary retention, and then obviously your more sensitive patients like the elderly, the pediatric patients, and your breastfeeding and pregnant women. Alright, now there are some drug interactions. This include, like I said, central nervous system depressants, antidiarrheals, anticholinergic drugs, because that can increase your side effect profile, which in this case is going to be urinary incontinence or urinary retention, as well as constipation. Now this is an interesting one that we don't always remember. Cimetidine actually also have an interaction with morphine or morphine derivatives because it decreases the elimination of the drug, and this means that levels in the body is going to be higher and your patient is going to experience more side effects. Alright, and then also metoclopramide and monoamine anhydrase inhibitors. Monoamine anhydrase inhibitors, which is also going to be an interaction. Now when we look at the side effects of morphine, it's going to be sedation, euphoria, it's going to be that constipation, we said urinary retention, that it's causing bronchospasm, or it can cause a depressed bronchoconstriction and respiratory depression. So it can cause that bronchodepression, respiratory depression, bronchoconstriction. It also causes severe nausea and vomiting. It causes miosis, which means the pupil is very small. It's a constrictive pupil, and then it can be addictive. Unfortunately, that is also one of the side effects of morphine. Now, just a note that you have to be cautious when you're giving this medication to patients with renal issues or renal failure, because this drug is excreted through the kidneys. Okay. Now the preparations that we get is going to be tablets that you swallow orally, like OxyContin or oxynorm. They only contain the molecule oxycodone. Then Targinact is a combination of naloxone and oxycodone. And then we also have the oral solution. So for you as a pharmacist that's working in the community or hospital setting, the oral preparation you sometimes will have to prepare for a patient. So you will get the powder form from your supplier, you will order morphine powder, and then you will have to mix that into a solution or syrup. Now I have a video on how to do a morphine mixture, which I will link in the card here on top, so you can have a look at that if it's in your setting that you sometimes have to mix this morphine. Now, if we look at the dosages, now the main thing with these drugs is you don't want to crush or chew this ones, you just want to swallow them. So my immediate release medications, it's going to be 6 to 4 hourly. Morphine has a short half-life, we give it 6 to 4 hourly. Even for babies, give it 6 to 4 hourly. Then the sustained release product we're going to give twice a day. You're going to start with a low doses and you're going to increase gradually, always when you're using morphine. The maximum dose for an immediate release is going to be 400 milligrams a day. The maximum dose for a prolonged release is going to be 200 milligrams a day. Alright, now let's move to another molecule, which is tapentadol. And the trade name for this ones we use most often is Palexia. Mostly given for your post-operative pain, moderate to severe pain. Also short half-life. The interactions are the same as the previous one. It's basically head injuries or increased pressure in the head. It's going to be something to do with bladder or constipation, colon. And urinary, it's going to cause urinary retention. It's going to can cause bronchospasms or respiratory depression. And then it can also cause acute pancreatitis. Or it's also contraindicated for patients with acute pancreatitis and like your breastfeeding and your pregnant women. Now, caution of this drug, Palexia, history of seizures and reset addiction and also depression. Alright, important that Palexia, the drug, the molecule tapentadol, can cause serotonin syndrome. So you want to be cautious when you're giving it to patients that are on antidepressants that is serotonin inhibitors. Okay. Oral dose is going to be a maximum of 400 milligrams a day. We are going to give it again 4 to 6 hourly. The sustained dose is going to be BD and it's going to be a maximum of 500 milligrams a day. If you want to stop a medication like this and you've been using it for a long time, you're going to taper gradually. Alright. Last drug that we're going to discuss is buprenorphine, which is going to be Temgesic, which is a sublingual tablet, or Sovenor, which is a patch that you put on. Transdermal patch that you change every 7 days. The sublingual tablet can take a dose every 6 to 8 hours. Now, the reason I quickly wanted to discuss morphine with you is because I had a patient with me the other day, and she needed Targinact for her mother, and she asked me what are the side effects that she can expect. So if I make a video, it's usually something that happened in my practice that I can relate to and I need to look up and study, and I want to give this information to you because I know that it can also be maybe prevalent in your practice, and you might also need to have maybe just a refresher on these drugs and how they work. So I hope this video was helpful to you. Remember, you can find the notes on my website, and also you can leave me any comment if you have any question. I would love to answer your questions. I don't say I'm very wise and I know everything, but I can really try. I am a pharmacist. I am working in community pharmacy right now. So whatever you may ask, I can try to check it up in my pharmacy. I can give you some practical insights. I really hope to hear from you guys. You must have a wonderful week, and that's all from me.